Oh. So before entering the room, I will check the electronic health record for any new lab values. I will check if there's any new or needed orders, and then I will check the doorway if there are any flags about infection prevention or any just severe allergies that I should be aware. Enter the room. Hi, my name is Anna.
Hi.
I will be your nurse today.
Okay.
Can you tell me your name and date of birth?
Yeah, Tayan Warner and January 28th, 2006.
Okay, I'm gonna check your wristband. Okay, looks good. So what brings you here today?
So I was playing soccer yesterday evening and I happened to just kind of trip, and ever since my ankle's been really hurting.
Oh, I'm sorry to hear that. So you said this happened yesterday?
Yeah.
Okay. What makes your pain feel better?
I've tried some icing. I had it elevated overnight and that seemed to help with a little bit of the swelling. Yeah, and the cooling kind of helps with some of that pain.
Okay. What would you say makes your pain worse?
Definitely walking around, trying to move around a lot.
All right. And then what would you say your pain's in one area, or is it?
Yeah, so I would say that it mostly stems just right on the top of my foot.
Okay. Does it radiate at all?
It does a little bit. I definitely noticed the pain throughout my entire ankle a little bit.
Okay. How would you describe your pain? Is it dull? Is it throbbing?
It's aching. Yeah. It's kind of sharp at times if I move it wrong.
Okay. On a scale from 0 to 10, I'm gonna show you the scale right here. How would you rate this pain?
I'd probably rate it a 7.
Okay.
Yeah.
Alright, so I will also, one more assessment for your foot. How often, I guess, would you say your pain is hurting?
It doesn't stop. Yeah, since yesterday evening,
it's
been
constant.
it's been constant.
Okay, so we are also going to check the patient's alertness, so you are alert, and then I'm going to ask you some questions about your orientation.
Mm-hmm.
So what is my name?
Anna.
Okay, yep. And then where are you at right now?
I'm in the hospital.
Yep. And then what is the date and year?
December 12th, 2025.
Yes, perfect. So now the patient is alert and oriented. She can hear and respond well to my questions, so her verbal and hearing skills are good. Then we will, so if your level of consciousness and alertness was not good, we would use the Glasgow coma scale, and that would assess your alertness. So now we will use this, and I'm gonna just measure your pupils on both sides. So look at this. That's about a 4, and okay. Your pupils are both about 4 millimeters, so that is good. And then I'll also just check your pupil reaction to light. So good and good. So your pupils are equal. They're round, reactive to light, so good. And then now we are going to assess your face. So your face is symmetrical. There's no ptosis or drooping. Then your body, it's relaxed and aligned well. Are you able to swallow?
I am.
Okay, so that's good. And then your hygiene is good too, so that is also good. Then we will also assess your skin. So your skin is well moisturized. It's even throughout. Am I able to touch and feel your temperature?
Yep.
Okay, so your arms, they're nice and warm bilaterally. And then can I also move down to your legs? And we'll just assess your legs. Okay, yep, good. And both warm, equal on both sides. Okay, we'll put that back.
Thank you.
And then if you had an IV, we would make sure that it's dry and intact, and we would make sure there is no inflammation, no infiltration. So just make sure, check on your IV. I'm also checking your skin integrity, and there is no lesions around. I'm also gonna check just right here quick to make sure it says no lesions. Obviously you have a sprained ankle, so it's just gonna be a little bit bruised and swollen, but we'll assess that. I'm gonna test your skin triggers, so I'm just gonna do a slight little pinch right here, and it goes away instantly, so you're well hydrated, so that is good. So if you were on a bed rest, we would just make sure you're on a turning schedule if you needed one. If you had any bed devices like air mattresses, we would just make sure that those are good and like fit to like what you need. And then we would also use the Braden scale to just make sure it assesses the risk of any skin breakdown. Okay. So yeah, okay. Then moving on, we're gonna do your arm strength, or just like your musculoskeletal leg strength. So we're gonna have you squeeze my hands. Good. And then you're gonna resist my force by doing like a curl and then go this way. Good. I'm gonna also do this side too, and then that way. Okay, good. And then we're gonna go move down to your feet. So that's okay. I'm gonna remove this. I'm gonna have you pull against me. Yep. And then push. Good. And then cover it up, like up. And then we're also have you lift your legs up. So like push up against me. Okay, good. And good. Okay. You have good like even strength. And then I'm gonna ask you a couple questions just to like assess your neural function. So do you feel any numbness or tingling? No. Good. And then can you just wiggle your fingers and toes? Okay, good. All right, now I'm gonna take your vitals. So I'm gonna start with the temporal thermometer and see what your temperature is. Oh wait, sorry, let me redo that. Good, 99.3 degrees. Okay, so now I'm gonna assess your heart rate, and I'm gonna do it at the apical pulse, and I'm gonna do it for 60 seconds. So I'm gonna just, is this okay if I lift right here? Yep. Okay, I'm gonna just assess your apical pulse, the mid-clavicular. Okay, so your heart rate was about 66 beats per minute, and it was a regular rate. And I also was counting your respiration, breath sounds, and you had unlabored breath sounds, and it was about 16 breaths per minute. And then I'm going to now take your blood pressure. So I'm going to just make sure that the cuff is the right size. So we're just going to measure. Okay, that's good. And we'll just put this on. So I'm gonna do a systolic estimate and just feel your brachial pulse first to see if I can do that. And then I guess I don't need this on right now. I'll just do your estimate right now. Sometimes this is, oh here, feel it. Okay, so I could no longer feel your pulse at about 120, so I'll just pump it up to about like 140, 150 to be sure. So we'll just wait like a few seconds before I measure your pulse. Okay, so your blood pressure was about 118/60, so that's good. It's within the normal range. So I'm gonna take that off. Okay. And then last vital sign we will take is we will take your pulse oximetry. Just wait for that. And that is about 97, so that is good. We just want it above 95%, so that's good. Okay, now we will assess your respirations, or your respiratory system. So if you had a nasal cannula, you would just check that it is intact, it fits well, and then just check the flow rate and like the medication for that. And then I will ask if you have a cough. Do you have a cough?
I do.
And then can you just describe like what kind of cough you have, like a dry, mucousy cough?
Yeah, so it's a little mucousy. It is getting a lot better. It's not quite as so frequent. Probably like once every 2 hours, and then I'm not producing quite as much mucus anymore.
Okay, that's good. What color would you say your mucus is?
It's like a light yellow.
Okay.
Yeah.
And then like how often are you coughing?
Yeah, like once every 2 hours, I would say.
Okay.
Yeah.
That's good. You're just probably getting over like a small virus.
Yeah.
All right. And then for respiratory, I will also so cough. Oh, we're gonna just go over some breathing. So like just make sure you just like take some deep breaths just so I can make sure that you're not using any extra muscles that aren't necessary. Okay, good. And then like also if you had a incentive spirometer ordered, we would just make sure you know how to use it and like the correct times you should be using that. So yeah. And then moving on to the cardiovascular system. So I'm just going to listen to your heart sounds, make sure there's, oh wait, I'm gonna listen to your, sorry, go back. We're gonna listen to your breath sounds.
Okay.
To just make sure your lungs have no like abnormal sounds. So I'm gonna listen to 6 spots in the front. Just take normal breaths. Good, and then I'm also gonna do the back, just a few spots. So I'm gonna move your hair a little bit. Okay, just take some good deep breaths. Okay, good. So there was no like crepitus or any other abnormal signs, so your respiratory and lungs sound good. So now we can move on to your cardiovascular system, and I'll be listening to just the 6 spots in your heart. So I'll start at the aortic, and then move to the pulmonic, the Erb's point, tricuspid, and mitral.
Okay.
So we're just gonna listen to that. Okay, and then is it okay if I just move this down a little? Okay, and then tricuspid. And okay, so I did not hear any murmurs, so like your heart sound sounded good, and I heard the S1 best at the apical pulse, so that was like about right here, and the S2 was at the base. That was where I heard that loudest. And then also for the heart rate, you would just We want to make sure that if you had an IV, we just are checking the flow rate and the medication that is being used for the heart rate. And yes, just make sure the flow rate is normal. And then we would also, I'm gonna check your pulses on your radial and tibial in your feet. So I'm gonna just make sure that your hip pulses are normal. Okay, good. And then I'm gonna move this down and check posterior tibial. I'm also gonna do both sides. Okay. Okay, and then I'm just gonna do the top of your feet, so your dorsalis. Okay, good. So that's, your pulses are about a 2+, so that means that they're regular, they're normal, and they were bilateral on both sides. I also forgot to check your other pulse on this side, so I'm just gonna do other radial pulse. Okay, that's good. And then for assessing your cardiovascular system, we would make sure if you have any, if you wear any compression stockings, just to make sure that they fit well. So do you have any compression stockings?
I don't, no.
Okay, so that's good. But yeah, if you did, we would just make sure that we educate and make sure that the devices fit well. Okay, so now we are moving on to the abdomen. So I will start by inspecting your abdomen just to make sure. So I'm actually gonna lower this and just see your abdomen. So your abdomen has the contour is flat. I don't see any lesions. You don't have any ostomies or tubes that we need to like be aware of. And if you did, we would just make sure like the skin is like not red or inflamed or any of that. Okay, then I'm gonna listen to your bowel sounds, and I'll start in the right lower quadrant. So okay, good. Your bowel sounds were pretty normal, no hyperactive or hypoactive sounds. I'm gonna just do some light palpation. Okay. Just let me know if there's any tenderness, distension. I'm just gonna feel if there's any like masses or any of that. Okay, good. And no like tenderness?
Nope.
Okay, good. So then I'm just gonna ask you a couple questions. Like, do you ever have any nausea?
No, I don't.
Okay. And then when was your last PM?
I would probably say, it was earlier today.
Okay.
Yeah.
And then like how often would you say your bowel sound or bowel movements?
Probably 1 to 2 times a day.
Okay.
Yeah.
And then I'm gonna have you look at this scale and just tell me like what type you think you usually have.
Probably a 3 or a 4. Yeah.
Okay, yeah, that's both in the normal range, so perfect. Then I think that's about it for the abdomen. Then we move on to the urinary system. So just how often do you go to the bathroom? Like, is your urine like regular, you would say?
Yeah, I would say probably once every 3 hours.
Okay, that's good. And then like what would you say the color is?
It's usually light yellow.
Yeah, okay, perfect. And then how much do you like feel you urinate?
Probably 1 to 2 cups.
Okay, good. So it's like about 30 milliliters you usually want. So and then like, do you have any pain when you urinate?
I don't.
Any like foul smells or?
Nope.
Okay, perfect. So like no signs of UTIs. And then if you have urinary retention, we would just want to make sure we use the bladder scan to assess that. And then lastly, I'm just gonna assess like how are your ADLs?
What does that mean?
Like your activities of daily living.
Okay. Pretty good. Obviously with my ankle, getting around is a little bit harder, but it's not really affecting what I'm able to do.
Right.
It's just making it a little uncomfortable.
So like walking is probably a little harder too.
Yeah.
would you like think you need assistance or?
I think maybe having some crutches would be kind of nice.
Okay, yeah.
Just because it is a little bit painful to
Right.
walk around on it.
Yes, we can look into that for sure. I think, yeah, so we're just gonna, since obviously you have maybe a sprained ankle, we'll assess that and take care of that. So, yeah, I think that's it here. Let me just raise up your bed to a comfortable position.
Thank you.
I'm just gonna do my final checks. Lower your bed all the way down. And then I'm just gonna make sure that it's locked, and I'm gonna go on both sides. And then, good. The side rails are up. Are you like comfortable?
I am.
Okay.
Yep.
And then your
Thank
collar
you.
right is right there.
Thank you.
So thank you for cooperating.
course.
Do you have any questions?
No, thank you.
Okay, perfect.